So the CDC recommended that ag workers be considered essential workers and that they be vaccinated. And the head of Human Health Services said that really we shouldn't be nitpicking over details, that people should be getting their vaccine as soon as they can. And if the vaccine's available, they need to get it. My husband is a healthy farmer, and he was able to get it 3 weeks ago, and he'll be getting his booster shot next week. So ag workers should be able to get the vaccine. The rules are kind of loose. The CDC has recommended that we not be too nitpicky about aggressively following the rules, that if a vaccine's available and an arm is available to put it in, then somebody needs to be getting that vaccine. There's plenty of people refusing the vaccine, and I think there is enough vaccine to go around. We've had several clinics in the area that have had vaccine they needed to get rid of, and so I think there's vaccine available, and if you're willing to get it, you need to go ahead and do it.
Talk to me a little bit specifically. You said that the farmers and ranchers fall under a certain class.
Phase 1B. Each state has its own decisions about this, but coming down way from the top of the U.S. government, the recommendation is that the states not be too picky about what their requirements are and if people are willing to get it. And so I would say ag workers are considered essential and have been since the beginning of this, and now is the time to take advantage of that and get vaccinated.
Talk to me a little bit about safety, because I know I've heard people express concern about, is it safe to take this vaccine?
Absolutely. So really all that got cut out of this was a whole bunch of red tape. And I say that nobody knows bureaucracy better than farmers do. You deal with the TDA and we deal with the FDA. And so even your reps for your cattle feed and things like this do have to deal with this research and development. And the FDA is pretty slow, and there's a reason. It is for safety, but a lot of it is for bureaucracy. And we have millions of people applying for drugs all the time to try to get drugs approved by the FDA. But all that got put on hold, and we fast-tracked the vaccine. And so it wasn't the research that got fast-tracked. It was not the science that got fast-tracked. It was the red tape. So what I'm so happy that we're seeing is that many, many, many people have been vaccinated now, and we're having really, really low vaccination side effects and beyond a really sore arm. And so the risks of problems with the vaccine, we know that if you're going to have a bad reaction to the vaccine, it usually happens within the first few weeks. And so we've seen all these people getting vaccinated. All your doctors and nurses were your guinea pigs, and we're all doing okay. So I think that the risk of the vaccine is very, very low. And I've known some fairly healthy young people who died from COVID, and I just don't want to see any more.
Absolutely.